Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all across the country. And some of you might be thinking, do I buy a practice or do I do a scratch start? Well, I've got one of the best in the country who took a scratch start in a fee-for-service environment, and you are not going to want to miss this. This guy, Dr. Eric Jones, brilliant. So do me a favor, grab a pen and hit the share button. We'll see you in a second. Hey guys, welcome back to the Best Practices Show. We are having so much fun doing these, so thank you so much for all your requests and the show topics. And today is one of those topics you guys have been wanting to see, and I've got my good friend and incredible young, talented dentist on the show. You're going to love this, Dr. Eric Jones. Now, couple show notes before we get started. We are shooting this live on Facebook, so if you're watching this live, please feel free to ask questions, and I will ask Eric the question directly when we see the question pop up in the feed. And the second thing is, we're loving the questions so much that every week we're giving away an Apple iWatch. We're going to be giving another one away today, just to the best question that gets asked. I mean, a thoughtful question, just because we really love the questions, and the questions are the answer. So keep asking them. And we're also going to give away 2 free tickets to Activate, which is our practice growth seminar, which is almost sold out for June, so you don't want to miss that. So make sure you check that out. Now, today's guest, if you're a young dentist or you're a mature dentist and you're going to buy a practice, one of the things you're always thinking is, do I buy an existing practice? Do I do a scratch practice? What direction do I go? And I'll just do my little intro on Eric. So a couple years ago, I was speaking at the Hinman Dental meeting, and I had this young kid. He was kind of like my room host, and I got a chance to meet him, and our relationship developed from there. And he was like, dude, you don't know how stressed I am. You know, I'm living in my mother-in-law's basement. I got a lot of debt. I got little babies. I don't know what I should do. I want to practice, but I don't know what I should do. And I said, go for it. And you went for it. And it is amazing. Now you're 34 years old, and you have an amazing practice, fee for service. And we're going to go into how you did that. But if people don't know who you are, because you've been out now speaking and teaching, who is Dr. Eric Jones?
Thanks, Kurt. Yeah, we had to get this in now, because pretty soon I had to drop the young claim to fame, right?
Right.
It's part of my no. So I graduated in 2009 from the Medical University of South Carolina, and then I worked with my uncle for a few years, and then we started having kids, and then we really realized that, you know, kind of having those discussions of where we want to be, what we want our life to look like. So we found a space, signed a lease, and just kind of went for it. So it was, that's funny. You know, I remember seeing you speak for years. We've known each other. We've worked together for a while now. But I remember, you know, at the time it was, you know, living, you know, back in my in-laws' basement, you know, $1,800 in my checking account, you know, to my name, brand new business, a 2-year-old, a 2-month-old, you know, and just like, what did I get myself into? But, you know, we really tried to look at it, you know, from the perspective of what kind of practice do I want to be, and go from that from the beginning. So, you know, all you hear now so much is, you know, sign up for 48 plans, you know, work till 9 p.m., you know, do a free cleaning, free extraction, you know, for life, you know, to get patients. And I was like, I can't do that. So we, you know, came up with our plan and went for it.
Yeah. Now I want you to talk about that, and you've got your 4th baby coming up here. So
right.
You told me, hey, look, you may have this week. So congratulations.
I may have to run right now. In 2 minutes, I may get the call.
All right. So we're going to get you as long as we can. Now, this is a really important topic. And now, before we go into the how and the details, because you're going to describe the details of how you did this, why is this such an important thing? You know, you being a young dentist, I understand the pressure. You know, you said you don't understand the pressure when you live in your mother-in-law's house and you have a lot of debt. I mean, that's a lot of pressure. You know, and you see a lot of young dentists that are trying to make this. Why is this such a big conversation and a big decision?
You know, and it's hard because I think everyone is trying to figure out what they want to do. especially, young dentists thinking about buying a practice, for starting a practice. For me, I looked for a practice and I just couldn't find what I wanted. It's like I was either compromising on where we wanted to be, or I was going to compromise on, what kind of practice it was. And just none of them were really fit. And then, there are some awesome practices for sale, but I'm like, what am I going to do? Buy a $2 million practice when I don't know that I can produce that, take out a huge loan, lose half the patients because I'm not, the senior doctor with gray hair and, is charming and all those things. I'm just a kid. And I walk in and they're out of there, and I have a huge note for it. So, I decided to do a startup practice, which I think more and more people are doing now, but that also carries its own, there's just so many ways to do it.
Yeah. So you practice in Flowery Branch, Georgia, which is the home of the Atlanta Falcons.
Yeah,
the Atlanta Falcons. We don't even talk about the Super Bowl.
I know that was bad.
Yeah. So now, and you had a big decision because with Delta, can you talk about that? Because, sometimes people say get on 28 plans type of a thing. And then you had an opportunity to go Delta Premier. Can you describe how that all worked?
Yeah, I will. And I know. Yeah, and that's the thing. Like, I know right now I have a buddy in Massachusetts, and they are going through the same thing of all of a sudden, Delta is a huge part of the practice. I think it's half their practice. And, half their patients have Delta. They're on as a Premier only provider. And then they get the notice that, in 30 days, you either sign up for PPO, all these patients are going to be PPO, or like you're out of network. Mm-hmm. And when we were starting out, we had a really short window when we could have signed up to be a Premier provider, which is what a lot of people in our area are. And like midway through looking at it, they converted over to say, hey, you have to do PPO and Premier. And I didn't do it. Mm-hmm. And, Delta's difficult because they're one that, a lot of them will send the check to the patient, and everybody's like, oh, you got to do it, or you won't see them, or you won't see the check. And honestly, I did the math and I'm like, you know what, if half the patients steal the check, I'd probably break even as taking a 40% fee cut, and I'm hopeful that half like us enough that, that even if we took assignment and they tell us they'll send us the check, they send it to the patient, we'll still come out ahead. So we stuck it out and didn't sign up with Delta. For people now that are knowing that going to be in that situation soon, as they roll out state to state of eliminating Premier, we decided that, what, we will just take our chances and try to, be as on top of the ball as we can with customer service, with attracting new patients, and, not be between a rock and a hard place with making a decision on that.
Right. Absolutely. Now, we could spend the whole time talking about insurance, and we're going to talk about some of those details here in a second, because what you did was way bigger than insurance. And we won't even talk about what you produce, but you're a monster producer and you do super high quality stuff. And I'm going to say this. You're not in some exclusive, beautiful, bluff where you have a standalone building. You're in a strip mall and so I asked you if I could say that, if the word strip mall, but the truth of it is that you don't have this beautiful Taj Mahal, do you? You started real simple. You kept it very bare bones when you got started. Can you talk about the whole process when you got going?
Yeah. And I think we all love to feel like, what, if I had this huge building, or if I was here, if I was there, if I had these patients that, maybe I could do it. But really, the truth is, when we started up, we were in a strip mall. We had 4 operatories plumbed, 2 built out, and like that was it. We had digital x-rays and like that was about all we had. We had no insurance participation. We had normal hours. We opened at 8. We saw our last patient at 4. So it's not like we were doing the 7 to 7 thing or anything like that. But instead, I was like, what, this is what we're going to do. We are going to, try, and in our case, we do a lot of sedation dentistry. We see a lot of patients that it's been a long time. So they feel like their mouth is a mess, or they're embarrassed to smile, or they have a fear of the dentist. But, I said, we're going to take those people, we're going to speak to that, and, not try and just copy where everybody else is going, which is, extended hours, cheaper and cheaper cleanings. I think every Tuesday, I'll go out, get the mail from our mailbox, and it'll be like 8 different dental flyers, and one of them's $59 for exam cleaning x-rays, one's $49, one's $1. So I'm like, oh, which one do I pick? Yeah. But that's so much of what we see now. And instead trying to create a different message. And then, really looking at really hard how we handle every aspect of the practice, from that first phone call, if they do call us, how we handle that, to what happens when they come in, to, all of those things.
Yeah. Now I will say this, I'm going to brag about you for a little bit because you are a student of the game, and those are people that I'm real big fans of. There are a lot of courses that you and I took together, and then I take a course independently and I just run in. You're like, I'm like, oh my goodness. Like you made a decision early on that you were going to be on a learning path. This is not about money for you. This is not about how awesome you can conquer the world. You've been a constant student of how I can get better as a leader, as a dentist, all that kind of stuff. Can you talk about that path? Because a lot of people aren't excited about that path. And they also say, I don't have the money for that. I mean, I got little babies. You're still having babies doing all this, you know?
Yeah. And I think, you know what, and I guess we didn't talk about that at all, but I think in the beginning, it probably was once a month, flying out, going to a course. So I went through and I did like a big sedation continuum where I was gone for like 3 weeks. I went and did some Dawson courses. I went and did some clinical mastery courses who actually teach with some now. And I think I did like 900 hours in the first 3 years or something, just trying to learn as much as I could, because it's one thing to get the patient in. It's another thing to get them to say yes, which we still work really hard on. I'm still learning about. But then the final thing is you got to be able to deliver, right. And to, not only say you can do it, but then to really, clinically have predictability with, knowing how your day is going to go, knowing you're going to be able to get them what you say you can do to make them look good when you say you can, all those things. And to not have it show back up with complications or, breaking porcelain or hurting or uncomfortable or any of those things.
Right. And I also have to scream about your team. You have one of the most incredible teams, groups of people around you. Can you teach us or give us some insight? How did you do this? Like, how did you find these people? How did you develop them? They're incredible. Yeah.
And I think that is huge. And I guess, kind of like behind every successful man is a woman backing them up. I know it's with my wife, but it's the same with our teams, and not to be sexist, there could be men on those teams, but it's something that, they are like, they are our business. You know what I mean? Like I'm the laborer, you know what I mean? I'm the technician or the carpenter, you know what I mean? But so much of having 100% confidence in the girls up front and Kimberly and Colleen that, they'll take that patient call, they'll make them feel comfortable. I know that we're going to get, 78% of them are going to come in, when they call for inquiring about anything that's a new patient. Once they come in, we have really one person dedicated to seeing all new patients. And I know that 80% of the time when she says, this, based on what you're telling me, this is what you can do, I know they're going to say yes, And then even from, like we talked about with learning the clinical side of it, knowing that, 80, 95% of the time I'm going to have, no complications on the clinical side is kind of the secret to what we do, even though it's not really a secret.
Yeah, absolutely. And the other thing too is you guys are just really good. Trust is such a big part of your entire new patient experience. And I want to talk about that as a cornerstone, because sometimes people are, you talk about the flyers, you talk about the marketing for a young dentist, you talk about all this stuff, but you have a lot of new patients calling your office, and a lot of them from different plans. Can you talk about this, what your strategy was when they're calling from MetLife? Because you realize it's not about that. Yes, they call about that sometimes, but our job on the phone is to help them see beyond that. Can you describe, you and I were talking about this before we went live. That was so beautiful.
You know what? And that is so hard is I think we all have our own filter lens that we look through everything at. So as dentists, we think about what it is a patient wants to know about their insurance. And if, I would say we have probably, I don't know, of what we do, probably $1.5 million a year is elective. You know what I mean? The other little bit is, necessary, like by necessary, I mean, cleanings, treating infection, treating a MO or DO with decay, but a lot of it is optional. Right. And those patients, everybody asks about insurance, because it's something that they want to use those benefits. But I think so often when they ask about insurance, I think a lot of people, it's easy to be quick to dismiss them. And even our team at first would say, oh, they asked about insurance. I'm like, what? They all want to know about insurance, is it going to help or is it not? But, it's like, we don't have HVAC insurance and we had to put in a new HVAC unit. You know what I mean? It's not like it's something that defines us at all. So it's really something that kind of is throughout our office and saying, what, does my insurance cover that? Well, it may cover some, but, this is what you're looking at, and making it simple. So, an implant, abutment, crown, maybe $4,200, like whatever your fee is, but saying, and you know what, sometimes insurance will help with a portion of that. But, worst case, you're looking at a total possible fee of X, and let them decide.
Right.
But I think that also comes from the new patient call. If someone asks about insurance, initially I know we had a new team member that was terrified to handle that call, because we weren't a provider on their insurance. So I'm like, well, if they're asking if we're in their network, then no. Or, if that's really their number one criteria for choosing a dentist, we may not be the choice for them. And that's fine. If they're just wanting to know, what, if I show up to your office, can I use my insurance? Absolutely. And when you come in, after we come in, sit down, come up with the plan, we can really talk, and tell you exactly what we expect your insurance to cover. We have a lot of patients with that plan, and then going into, how we heard about them, or how they heard about us, I'm sorry, and because if they're calling about implants, if they're calling about aesthetics, if they're calling about all these things, it doesn't really, insurance doesn't matter.
Yeah.
If they're calling about a cleaning, it may be $30 extra or something, you know what I mean? But it's not a big deal. But if we see their mom, their neighbor, their, you know what I mean? Like, they don't care. They just want to know, can I, you know what I mean? Am I going to have this huge expense, or what's the deal? And I think, learning not to assume is the biggest thing.
Yeah. And you've worked with your team so well on this, and, whether it be Kim on the phone and actually Justin just made a comment. Thank you for saying that. The number of dentists that do not realize the value in a practice manager and team is just too many to count. I agree. You guys are so good at entertaining those phone calls. Can you just talk about how that all works at the front? Because I've called your office and I don't care what you're saying. I'm saying yes to it because they are so good and they build a lot of value up there. But it's really a process where you guys have to work together and all be on the same page. Can you give us a little bit more insight on that?
And I think initially it's one of those things. I think you gave us our first phone sheet that you got from Brian Smith or somebody, that was looking through, going with, going into, when the patient calls, we have that. We still use a pink sheet, even though we're almost all digital, we throw it away when we're done, but so that they know that it's a new patient on the phone. But really being curious is the biggest thing, because everyone, first three questions are, typically either, where are you? Because they don't know what to ask, or do you take this insurance? Or it's one of those basic 2 or 3, but then really finding out their name, finding out, how they heard about us. Because, that normally leads into, well, so-and-so and it may be one of our favorite patients and, that loves us and we love them. And, we did a huge case on them or their husband or whatever. Like, we know if they sent us someone, that's awesome. So we're trying to create that connection, find out, why it is they're calling. There's a reason that they picked up the phone today. It could be it was on their list to scratch it off. It could be, there's a reunion in a month they got the RSVP for or something, and they're freaking out about how their teeth look or whatever. So, it's really being curious, and then that going from top down, so our front desk is curious about why they're calling, how they heard about us, and just listening, all the way to the hygienist seeing that new patient the first time, or all those things.
Mm-hmm. Yeah, and the cool part is through this whole process, you made your practice yours. You didn't follow any particular template. Yeah, I mean, I was there to help you with some of those pieces, but it's really important because a lot of dentists make excuses. They say, "Oh, I can't do this," and you talk to a lot of them. They're like, "Oh, I can't practice that way. There's no way," And you've just never been one that subscribed to everybody else's excuses.
Yeah, and I think too, when you look at it, when you look at what everybody else is doing, I think that's the fastest way to be average, So in doing a fee for service startup, it seems like economic suicide, but I'm like, if the whole current is going this way and I'm going the other, I'm either going to drown, you know what I mean? Or I'm going to find some land that no one else has found, And I think it's a little bit of it's courage for sure. But having a plan, built around that.
Yeah. Absolutely. And then as far as, your systems and everything, you guys have worked really, really hard on your systems. And the cool part about this is that when you get it organized, like you guys have, you don't have to be open extended hours. Not that that's bad. I certainly don't want to come across as we're anti-extended hours, but you see people now that are open full days on Saturdays and Sundays, and some of them working, some of them are open 7 days a week and they don't produce anywhere near what you produce, and you're only doing it 4 days a week. It just speaks to, it's not how hard you work, it's how you think about your business and the value that it creates for the people around you. And doing a scratch start, how many years now have you been? It's
5 in the fall, so we're going into 6 years now.
Okay, 6 years. So when you look back at the 6-year journey, what would you do differently, or what would you do the same in that respect when you look at these journeys?
No. I mean, that's an awesome question. I think I would have paid a lot less attention to what other people are doing or the negative like stuff in my head. You know what I mean? Early on, because I think even for years you worry about, the what may happen or the theoreticals. And we spend so much mental energy, thinking about all of that. Or one patient makes one comment, that's negative, and that just ruins your day. Right. Or one complication and maybe the patient's not even upset about, but we just we take that home. It sits on us and it's like this monkey on our back, So I think I would pay a lot less attention to that and be more focused on, just what it is I want to do, and really focusing on just not feeling like I had to do it all overnight, but picking one thing at a time, to try and really, focus 100% effort on and then move on to the next thing.
Right. Right. And then, the other thing that I've noticed that you do really well is you are a genius with marketing. You've never done the traditional marketing. One of the first things that you published that I absolutely love is you produced a white paper that was basically questions to ask your dentist. And you didn't necessarily say, come to me. You're like, hey, look, if you're going to go to a dentist and you're going to make decisions about your smile, here are some considerations. And talk about that. First of all, if somebody's watching this and they don't know what a white paper is, you've been a pioneer in kind of the drip sequencing, identifying the right type of patients, because you did flood your practice. And then you're like, hey, look, I want to do more aesthetic, discretionary dentistry. How did you take that turn? And how is that such an important part of your business model now?
Yeah, no, that's an awesome question, because, it's funny. I look at it and I think our average or net new patients, like it swings and it varies, but we may have seen 40, 50, 60, maybe like the first early year or two. And then there were points in like later down our career, even where we'd see 16 new patients in a month because I was gone a lot or I was busy, but we'd see 16, we treatment plan, $300,000 worth of treatment and do 200 of it. And I'm like, how does that even work? When I was taking, 70 new patients to do, $70,000, 2 years ago.
Right.
But I think really the biggest thing is creating the structure. So for us, it is speaking to someone that's embarrassed by their smile. They have, missing or broken teeth. They are overwhelmed or fearful of maybe fearful of pain or maybe fearful of being judged. But really just putting that message out there. And then really, just trying new things. I think one thing we have a ton of success with now is even the idea of like quizzes. So it started out with a quiz on Facebook to see if you're an implant candidate. And now that's like so much of our strategy, even on our website. If you go there, you can take our quiz to, our virtual consult to find out, really like, what is your problem? Are you embarrassed by your smile? Do you have missing teeth? You're scared of the dentist. You're just looking for a dental home. And then once you know that, we are really working to send them information, to basically information-driven marketing and not so much fee-driven marketing, And it's crazy. We had a patient that we signed up for the ebook or the white paper you're talking about with how to choose a dentist. And in that, we just, I just laid out here's what I would ask. I'd ask about, how much training do they have doing this? Can they show me some photos? How do I know, I'm going to love my result? Like all these things, and basically just setting the criteria that I would use, which, maybe points towards me or not. But either way, even if they never come in and see me, it's still helpful information. And we'll send that out, and we will have patients reply to those emails that they saved like 9 months ago that said, one said, I'm finally ready for you to come in and look at my mouth. It's a mess, and we're like, no, come on in, we'll figure it out, and like, those are awesome patients. And, that is the kind of dentistry that we get hugs from. You don't get that from doing a DO on number 2 or whatever,
Yeah, absolutely. And what you guys have learned is that sometimes these nurturing points, it's not about right now. Sometimes people will see one touch from you here 1 month, and later on, then they get a chance to meet you. Then they come into your office, and it might be a while before they actually do comprehensive restorative dentistry, but you've got enough in the pipeline from all these conversations that you're having that you just wake up and you're like, wow, that was really fun.
Yeah. And I think it's so tempting to do a Groupon or whatever, and
Right.
see 68 new patients that come in for a $25 cleaning that they get half, but really it is, we will have people come in with a trifold brochure that we hadn't done in 3 years, and they'll be holding on to it. And it's like, they've held it all that time. It's like, I hadn't mailed that since 2013, and they'll show up with it. So I think we are all incredibly impatient when it comes to marketing, when it comes to our practice, when it comes to, if it's implementing systems, wanting it done, tomorrow this way. And I am the worst about it, but it's all building on one another, and we have people responding to emails that we sent out, months and months and months ago. We have people showing up with printed materials that we did 2 years ago.
Mm-hmm. That's so cool. And I also want you to speak to, one of the things that a lot of people debate are watching a few dollars here to get, 50 more thousand out of your hygiene department per year and things like that. And you're like, come on, guys, just focus on the right things, because a lot of this can be made up with just really creating great relationships with a few patients type of a thing, and then trying to squeeze a $5 here, $10 here. Can you talk about the difference in that thought process? Because you do look at your numbers. Your numbers are important to you because obviously you want a profitable business, but you know where to put all of your energy so it gives you the biggest return.
Yeah, and I think now you see so much of the drive to do everything by metrics, right? Mm-hmm. Like it's like you have some war room with like 9 computer monitors, like a stock trader, that you're looking at your hygiene prophy to fluoride rate, and you're looking, and like that's great, and I see the value in that, but that's ridiculous. Like I think sometimes for what we do, I mean, it's like we could try and push adult sealants, every day for a year, or I could get, 2 implants and cancel all that out. You know what I mean? Right. And that's how sometimes I think about it. Numbers are important, but really, like what I said from the beginning with our team is, we're going to do an awesome job answering the phone. And by an awesome job, I mean, I think that 75% of all people that call should come in. Right. I think nationally is like 30% or something, pretty awful or abysmal. Most times don't even ask, right? Don't even ask would you like to make an appointment? Instead it's like, answering question. You need to call your insurance and find out what they'll cover. Here, I literally heard someone telling me about they overheard the front desk giving out codes for the patient to call the insurance company to ask about. And I'm like, oh my gosh, like, do you want to come in? Yes, great. So we really just track how many people come in compared to how many call. We track basically how many people move forward with treatment. They come in that we present, and then that's really it. Those are our 2 numbers. Yeah. And I think numbers are important, but I think it's so easy now to get so bogged down and feeling like you have to have we track our reappointment rate too, just to see if we're shrinking or growing, to kind of have an idea of hygiene going. But like that's it.
Right. And you guys have a full-time person and really a whole team that's really dedicated to listening to patients. Like you really listen to patients' stories, get to know them very well, find out why they're coming in there. And can you just talk about that? Because really, I think that's a huge differentiator for you and your practice than somebody who's trying to do fee-for-service, because you can see what you guys do. Like there's a lot of hugging going on. There's a lot of really knowing people's stories and then transferring the stories between team members, as where other people that are trying to fee-for-service are just looking to see how they can get a few big cases here and there, try to make things easier in the practice. Can you talk about the listening aspect of what you guys do?
Yeah. So, I think a lot of it is like knowing why it is they're asking the questions they're asking, or kind of like what's their motivation behind it. And so often the patient may be asking about, they may be asking about something because, really, normally when we look at a patient and the patient has, let's say every tooth is a giant amalgam, their front teeth, like number 9 is a PFM that was done in 1978, and then they're asking about dentistry all of a sudden. It's like, okay, in my head, I'm like, why now? You know what I mean? Like you've probably been browbeat by 50 other dentists in your lifetime, but normally there's something going on. It could be a reunion. It could be a wedding. It could be, just something happened. Finally, they have the funds to do it. And I think our team, the team is just amazing at figuring out why they're asking and even what's possible. I think it's, we had a patient the other day that the oral surgeon originally saw to take out some teeth, do some grafting and place some implants. And he sent them back to us and said, you know what? I don't think I have enough space to get the implants in because he has a really deep bite and the teeth are super erupted. And, maybe you need to talk about maybe taking out the tooth below it or grinding it down or whatever. So he sends them back and I'm like, okay, we can talk about that. And I'm like, well, we could do that and we can talk about that. Or we could just talk to him about, what if we redid your mouth? What if we did a rehab on you? And so let him pick, give him both options. And I think I was scared initially. I didn't even think to say, you know what, you have a deep bite. Every other tooth is either a huge filling, a huge crown, or an old crown that is A4. Like, why don't here's what we can do. We can do this, this, and this, get your teeth back and get your implants in, or we can talk about rebuilding everything. And, he said, well, let's do that. And it's like, still we have those moments where we're kind of surprised when they say yes, and I'm like, how many people did I cheat out of what I would do, or what I would do if it was my dad and he wasn't paying for it, and say, no, I'm not doing that. I'm not pulling a tooth to make room for an implant. Like, you get ortho, or we, increase your vertical or whatever. So I think it's not making those choices for them and telling them what their options are, what cards they're holding, and letting them pick.
Yeah, and we've heard this from so many dentists before. One of the most freeing places to ever be as a restorative dentist is to detach yourself from what you think a patient might say. And it's the game changer, because now you're just doing the right thing instead of worrying about how they're going to respond. And did you feel that transition happen for you, and it opened up a whole new world of possibilities?
Yeah, and I think so. It's so easy to take that no as like a personal insult, you know what I mean, to your skill or your training. But really, it's like, just tell them what their options are, and they can pick what they think is best for them. Because we want to help them. We want to know why they're asking those questions. We don't want to assume. We don't want to give a huge treatment plan to someone that's not ready, and assume they're not ready. But sometimes it's just finding a nice way to say, you know what, here are your options. You can do nothing. You can fix this one tooth, or we can, look at why you're breaking teeth in the first place.
Right. Now, I do want to ask you a somewhat controversial question, because the fee-for-service scratch start sedation is always like a really good corner. How important was the sedation piece to your fee-for-service scratch start, or was it not?
No, I think it was big. Initially, it's funny. We would sedate like 1 or 2 patients a day and everything we did. We still do a lot, but so many of those people now are realizing they come in responding to that, but we end up not sedating them, or we do nitrous or something for treatment. Right. But I think a lot of their fear is just fear of judgment, or fear of the unknown, or unfamiliarity. So I think the biggest thing about it, and being huge for our practice as a startup, is really just a different message. As we weren't focused on cleanings, we focused on people that are scared of the dentist, which with that brought people that had, they had fear. They had a lot of dentistry that needed to be done. And then those people are like the advocates and missionaries of your practice. When you get them in, you get it done. They don't even remember it, and they're done. Like, they are, sending you everybody they know. So that's how it was huge for us.
Yeah, absolutely. Now, another thing that I've watched you pioneer, and I've always heard this debate back and forth, in a fee-for-service practice, you really want to stay away from itemized treatment, because people can start to pick, and this is especially important when it comes to the insurance aspect. Can you just talk about your journey in that? Because I've always been a big fan of not itemizing treatment, just because of that. Now, you see this every single day, and you guys do it so well, Tell us, or the people that are watching, if I'm a young dentist, why that's so important in your journey as a fee-for-service dentist.
Right. So I think initially we started out doing what everybody does, and that's like the Dentrix printout of like every single code, every single description, right? And you get patients like, well, let's do this one, this filling, and then we're going to skip this. And you're like, no, it doesn't work that way, right? Right. Or you get in this huge plan, and they say they're ready to go, and they're looking at it, and they're like, well, what's this equilibration thing for, $1,800? And you're like, oh my gosh, and you're answering this question. So we pretty quickly went away from doing that to like an Excel spreadsheet that had basically, we summarized what the treatment was by like what teeth. So crowns, teeth, 8, 9, 7, 10, limited orthodontic treatment, lower arch, and bleaching. So we give them that and have a total number. And then that number would be less any insurance payments and broken up by payment options. So we did that for a while. And I think it was huge, because we had team members. I didn't think it would work. We didn't think someone would be like, okay, that's great. But they don't know that, what we all do is we give them that Dentrix list, They're like, oh, great. There are the teeth. There's what we talked about. There's listed. Here are my payment options. And here's how much insurance could possibly pay, which is $1,500, right? But then I think that belief got challenged even more when I'd had one of our team members, presented a case verbally for, she'd verbally or wrote down a sticky note, 39,000 or something, and gave it to him. And I was like, oh my gosh, like, that's what you gave them? And she's like, they said yes. And I'm like, no, you cannot give them that. We have to have this like 8-page review of findings report. We can't do that. But it's like the communication on the front end, the understanding why they wanted to do it, the connection, the bond, like seeing them as a human, eye to eye, knee to knee, was so powerful that, the number is just a number. The rest was just details that they weren't that worried about or we could figure out later as far as the sequence and, exactly what that made up that 39 and all that.
Yeah. And it just speaks to when the value is clear, the price is easy. When the value is not clear, the price is hard for a lot of times in a practice. Now, I am going to ask you this. What do you think the future, you're 34, you've got 3 decades and in front of you. What do you think the future of dentistry looks like? Because I look at you as one of those, I'm so proud of you in so many different ways, and you're a pioneer out there, and you're continuing to create great value for the people around you and us. I'm just watching you do what you do. But, what do you see in the future of dentistry in the next 4 or 5 years? As you listen to everybody comment on the landscape of dentistry?
Yeah, I think, in some ways I get so tired of the doom and gloom, with it. I mean, when we started, it was like the double dip recession, and then so it's like, if I had listened to that completely, I think we would have been paralyzed and done nothing or worse, just gone with the flow. But I do think it becomes more and more important to be differentiating, it used to be just customer service would do it. I really think. I think, if you were just nice to people and answer the phone, didn't have a clipboard, that's all you had to do. And that's getting more competitive and that's changing. I do think it's becoming more of a tiered system. Right. So you see these, corporate practices. We have 3 Heartlands within 2 miles of us. So I get all their mailers, and I'm like, oh my gosh, but, I think the 7 to 7, highly insurance dependent, there's obviously a market for that. I think it's going to be big. But I also think, if you're willing to build your brand, your marketing, your practice on, solving problems that patients have, I think there's always going to be a future for that. There's always going to be a future in fixing something somebody wants fixed. And by that, I mean, the more specialized and the more niche you can kind of be, I think that's where a lot of it's heading. So unfortunately, I think it's that middle ground that gets killed, we do kind of a good job of customer service and we do pretty good dentistry. It's quality, and all that. And I think that's easy to get killed when you say, well, our prices aren't the cheapest, but they're not the highest. They're kind of in the middle. I think that's going to be harder and harder going forward. I think it's going to be, you have the top 5-10% of fees, and then you have a whole bunch at the bottom. So I think that bell curve is really kind of narrowing out, in the coming years.
Yeah, absolutely. Absolutely. And, as far as any last pieces of advice you'd give somebody doing a fee for service or scratch start, things that for sure that you'd say, hey, look, one of the things you do want to do is this.
Yeah. And I think you have to absolutely, be amazing on the phone. When the patient comes in, you really want to, create a bond, create rapport, and then lay out their options, but you have to be amazing at the case presentation. Right. I would say, and figure out a way to, market a little bit differently. So if you go in there and try and keep getting cheaper and cheaper on the cleaning exam x-rays, I think you're going to get killed, or it's a hard road, Yeah. But I would also say that don't get caught in the trap of thinking that you have to have every gizmo, we have a cone beam now, we 3D print guides, we do all that, but it was years before we got there. We had digital x-rays and an HD monitor in the ceiling. That was our tech, you know what I mean? To start. So I think, keep your overhead down. Don't be afraid to market. And then when you do, don't be afraid to be a little bit different with it,
Absolutely. And you've never been afraid of what anybody else would say or what they would think. You're just like, I'm going to do it my way. And it's worked out really, really well.
Absolutely.
So, it's good stuff. So I know you're probably going to get a lot of questions. And again, if you're watching this is one of those guys that did it and continues to do it right. So if you have questions, please, I encourage you to put them in the feed and ask Eric. He's fantastic at being able to get back to you and answer your question. Now, if people want to get a hold of you, how can we, I am going to encourage, if you're watching this, go to his website and look at the ways that he engages a lot of his patients. Now, you have the quiz right there on the homepage. Is it right there?
You know what? And that's so funny. We're always tinkering with it. But yeah, you have the option now to go for a homepage. I think you can take the quiz, see if we're right for you. And then different other pages, you're able to go in and take the, watch videos, take the consult, all those things. So, it's something that I love. We still tinker with, I think right now we have updates going where we're kind of switching it up, but again, just having a little bit different message than listing services and all that, like we used to do.
Yeah, it sounds good. I'm going to have you back on a whole bunch of other subjects. But I'm so grateful. And I know you got another baby on the way. And
number 4.
So it's going to be fun. 4 is great, man. It's awesome. So do me a favor, just stay up for a second. I want to chat with you for a little bit after we go. But if you're watching this, Thank you so much for watching. We are so grateful you guys are watching, and we're so grateful if you enjoyed today. Please hit the share button and share the good word of what Eric is talking about. And please keep giving us suggestions on great shows, and we're going to be lining up and making them happen. So until we see you next time, thank you so much. Keep watching Best Practices Show.